1. A new teacher in your child care center is unclear about hand-washing protocols. As a mentor, what is the most effective method to support the teacher's understanding and compliance? A. Provide the teacher with a hand-washing poster and move on. B. Email the teacher a list of health policies. C. Model the hand-washing procedure and observe the teacher's practice. D. Ask the teacher to look up state regulations independently. 2. During an evaluation of a nutrition activity, you notice children are not engaging with the food items provided. What should you do as an instructor? A. Replace the food with treats to capture attention. B. Ask the children to sit quietly and listen. C. Revise the activity using sensory-based exploration and group discussion. D. Discontinue the lesson and move to free play. 3. A CDA candidate is developing a safety checklist. Which of the following best demonstrates compliance with national safety standards? A. Listing classroom rules. B. Including routine inspection of fire extinguishers. C. Creating a reward chart for good behavior. D. Including daily attendance forms. 4. How can a curriculum developer integrate adult learning principles into a health and safety training module? A. Focus on theoretical knowledge only. B. Use only videos for delivery. C. Include hands-on activities and real-life scenarios. D. Require only reading assignments. 5. You observe a child care provider improperly storing hazardous cleaning supplies. What is the best mentoring approach to correct this? A. Leave a written note for the provider. B. Report them to the licensing agency immediately. C. Provide immediate feedback and review storage protocols together. D. Avoid confronting them and hope they change behavior. 6. When evaluating a CDA candidate's nutrition lesson, what is a key indicator of developmentally appropriate practice? A. The children memorize food groups. B. The children taste and describe different healthy foods. C. The children write a report on vitamins. D. The lesson includes advanced dietary calculations. 7. A teacher consistently forgets to document daily health checks. As a clinical supervisor, what strategy should you use? A. Assign the task to another staff member. B. Document the lapses without follow-up. C. Coach the teacher using a checklist and reflective questions. D. Ignore it unless a health issue arises. 8. Which of the following is the best example of a responsive curriculum design for health education in early childhood? A. A rigid weekly plan reused every year. B. A curriculum that adjusts based on observed health needs and interests. C. A curriculum based solely on federal standards. D. One designed only by administrators. 9. You are designing a training session for new teachers on safe sleep practices. Which adult learning strategy is most effective? A. Lecture for 90 minutes. B. Group discussion of case studies involving real sleep scenarios. C. Assign reading on SID statistics only. D. Use only a multiple-choice quiz. 10. What action ensures regulatory compliance in nutrition service delivery within a child care program? A. 1. What allowing families to bring in fast food? B. Offering sugary snacks in moderation. C. Following CACFP guidelines for meal planning and documentation. D. Serving whatever is least expensive. 11. A CDA candidate asks for feedback on their emergency preparedness drill. What is the most constructive response? A. Good job, keep it up. B. You did it wrong, do it again. C. Let's review the procedure and discuss what went well and what could improve. D. You'll figure it out next time. 12. When mentoring a teacher on injury prevention, what is the most effective approach? A. Use scare tactics to emphasize risks. B. Share stories of past injuries only. C. Engage in walkthroughs and collaborative hazard identification. D. Leave safety up to common sense. 13. A training session on infectious disease control should include which adult-centered instructional method? A. A lecture with no interaction. B. Role-playing hygiene scenarios and evaluating outcomes. C. Requiring a silent reading period. D. Showing a documentary only. 14. What is the most effective method for evaluating a CDA candidate's health curriculum? A. Asking children if they liked it. B. Reviewing the curriculum's alignment with health standards and observation of its implementation. C. Giving a written test to the teacher. D. Having them email the lesson plan. 15. Which of the following best supports communication with families about safety practices? A. Posting reminders on the bulletin board only. B. Sending weekly newsletters with updates and tips. C. Expecting families to ask questions if concerned. D. Referring them to licensing websites. 16. A CDA candidate plans a nutrition activity but omits food allergies. How should a mentor address this oversight? A. Add it yourself without telling the candidate. B. Ignore it if no issues arise. C. Engage the candidate in discussing allergy policies and adapting the plan. D. Punish the candidate for the mistake. 17. In clinical instruction, what is the best way to teach correct diaper changing procedures? A. Describe the steps verbally. B. Provide a written list. C. Model the process and supervise hands-on practice. D. Have students observe other teachers only. 18. A CDA candidate struggles with managing safety drills. What strategy enhances learning retention? A. Increase verbal warnings before drills. B. Discuss and rehearse drills using visual aids and peer feedback. C. Limit the number of drills conducted. D. Have another teacher run the drill instead. 19. A nutrition lesson on portion sizes would most benefit from which method? A. Showing a food pyramid. B. Reading nutrition labels. C. Hands-on use of measuring cups and food models. D. Giving a quiz on serving sizes. 20. A candidate plans to display emergency numbers. What demonstrates regulatory compliance? A. Posting them in a teacher's notebook. B. Keeping them in a drawer. C. Displaying them clearly next to all phones. D. Memorizing them only. 21. What is the most developmentally appropriate way to involve children in safe practices? A. Reading safety rules aloud. B. Requiring them to write out rules. C. Modeling and role-playing safe behaviors. D. Giving them a pop quiz. 22. A CDA candidate includes sugary snacks in their nutrition lesson. What is a proper response as a mentor? A. Ignore it for now. B. Approve it as long as children eat. C. Discuss alternatives and align the lesson with health guidelines. D. Replace it with treats yourself. 23. You're designing a professional development session on choking hazards. What approach best engages adult learners? A. PowerPoint only. B. Group analysis of real case studies with hands-on object examination. C. Memorizing lists. D. Showing a video then ending session. 24. A teacher fails to follow glove protocols during diapering. What is the best evaluation method? A. Ask them to reflect in a journal only. B. Watch and give general praise. C. Observe directly and provide targeted feedback. D. Assume they know the policy. 25. What is the primary goal of evaluating a CDA candidate's health portfolio? A. To ensure creativity. B. To test memory. C. To verify alignment with CDA competency standards. D. To assess artistic design. 26. How should you guide a teacher in selecting developmentally appropriate nutrition materials? A. Choose the most colorful options. B. Select based on age, culture, and health objectives. C. Use any resources found online. D. Pick what's cheapest. 27. What is a key method to reinforce hand-washing routines among staff? A. Mandatory tests only. B. Surprise inspections with penalties. C. Ongoing modeling, reminders, and feedback. D. Avoid mentioning it unless illness spreads. 28. A new staff member is unclear on food storage safety. What is your best action? A. Leave written instructions. B. Refer them to a website. C. Provide hands-on training and supervise practice. D. Assign them kitchen duties immediately. 29. When mentoring, how can you promote reflective thinking in health and safety? A. Provide all answers in advance. B. Ask candidates to journal challenges and solutions. C. Skip reflection to save time. D. Use checklists only. 30. Which of the following most accurately represents a child's nutritional need? A. All children need the same serving sizes. B. Needs vary based on age, activity level, and individual health. C. All children should eat adult meals. D. Calorie counting is required. 31. A CDA candidate uses bleach without dilution. What's the appropriate corrective action? A. Ask them to stop immediately and retrain with proper safety guidelines. B. Assume it's effective. C. Let them use what they prefer. D. Have another teacher correct it. 32. How can a mentor evaluate whether a teacher understands safety regulations? A. Ask yes/no questions. B. Observe classroom practices and engage in reflective dialogue. C. Review past safety incidents. D. Look at their certification date. 33. What teaching strategy best supports adult learners in nutrition education? A. Memorizing food charts. B. Watching long lectures. C. Creating meal plans based on real menus. D. Copying textbook content. 34. A CDA candidate forgets to include a first aid kit in their classroom setup. What is your best response? A. Add it yourself. B. Discuss safety policy and work together to identify missing components. C. Let licensing handle it. D. Leave a reminder note. 35. What best ensures children's dietary needs are met in a group setting? A. Serve the same meal to everyone. B. Allow children to skip meals. C. Consider allergies, cultural needs, and preferences. D. Let parents decide daily meals. 36. Which is the best tool to evaluate a candidate's ability to implement safety procedures? A. Written essay. B. Peer review only. C. Direct observation with a performance checklist. D. Video presentation. 37. A candidate wants to teach children about germs. What method supports learning best? A. Show them a diagram only. B. Read a book aloud and test afterward. C. Conduct a glitter activity simulating germ spread. D. Play a cartoon with no discussion. 38. Which is most effective for teaching safe use in early childhood? A. Verbal rules. B. Showing warning labels. C. Demonstrating use and allowing practice. D. Posting toy rules. 39. What role should a mentor play in supporting a CDA candidate's health practices? A. Monitor from a distance. B. Provide corrective criticism only. C. Offer modeling, feedback, and collaborative problem solving. D. Let them learn through mistakes alone. 40. A CDA candidate is confused about food portion sizes. What is your best mentoring approach? A. Tell them to follow the food pyramid. B. Hand them a portion chart and walk away. C. Use real food models and practice portions together. D. Tell them to measure everything strictly. 41. What is the most reliable way to evaluate health and safety knowledge retention? A. Surprise pop quiz. B. Monthly written exams. C. Scenario-based assessments and observation. D. Staff meetings only. 42. What is a key principle of adult learning in clinical training? A. Repetition without context. B. Passive listening. C. Relevance to real-life experiences. D. Memorization. 43. A teacher neglects to document an accident report. What is your role as a supervisor? A. Ignore unless severe. B. Write the report for them. C. Review the importance of documentation and provide follow-up training. D. Discipline immediately. 44. A nutrition lesson includes soda tasting. What's the best response as a mentor? A. Applaud creativity. B. Ignore unless a parent complains. C. Discuss healthy alternatives and align with dietary guidelines. D. Add water as an option. 45. Which of the following is a performance-based assessment tool? A. Final exam. B. Self-evaluation form. C. Observation checklist during live teaching. D. Attendance log. 46. What is an effective strategy to support new staff in implementing safety policies? A. Trial and error. B. Assign without training. C. Provide onboarding sessions and hands-on guidance. D. Allow them to observe only. 47. A CDA candidate plans meals without allergy considerations. What is a compliant mentoring action? A. Let it pass if no reactions occur. B. Adjust it yourself. C. Educate the candidate on allergy management and food safety. D. Tell them to avoid planning meals. 48. Which technique aligns with adult learning when teaching health documentation? A. Reading policy aloud. B. Group brainstorming on best practices. C. Timed quiz. D. Giving out templates. 49. A candidate's health area lacks ventilation. How should you respond? A. Open a window occasionally. B. Report it immediately. C. Collaborate on solutions to ensure air quality meets standards. D. Close the area temporarily. 50. Which of the following best reflects responsive mentoring? A. Giving only written feedback. B. Following a strict script. C. Tailoring support to the candidate's learning style and goals. D. Supervising from a distance. 51. What practice supports safe food handling in childcare? A. Wearing gloves only for meat. B. Preparing food without jewelry and washing hands. C. Letting children serve each other freely. D. Using same utensils for all foods. 52. How can you promote safety awareness among early learners? A. Tell them to just be careful. B. Use repetitive rules. C. Include games, songs, and visuals. D. Post rules and don't explain them. 53. When evaluating a candidate's first aid skills, what is most appropriate? A. Written test. B. Group discussion. C. Simulated injury scenario. D. Reviewing textbook responses. 54. A CDA candidate skips fire drills due to rain. What's your next step? A. Agree with the decision. B. Ignore it. C. Emphasize regular drills and help plan alternatives. D. Wait for licensing feedback. 55. What's a key element in evaluating nutrition curriculum for young children? A. Cost of materials. B. Engagement and alignment with dietary guidelines. C. Time spent teaching. D. Use of visual charts only. 56. When developing safety content for staff training, what approach works best? A. Repeat state laws verbatim. B. Use infographics only. C. Blend interactive scenarios with regulation review. D. Assign a reading packet. 57. A candidate has difficulty organizing health forms. What is the best support method? A. Do it for them. B. Ignore it for now. C. Offer coaching and a sample system. D. Tell them to try harder. 58. How do you ensure child-specific health needs are met daily? A. Ask children how they feel. B. Rely on parents to remind staff. C. Maintain updated health records and communicate regularly. D. Post symptoms on a chart. 59. What action promotes a safe learning environment? A. Decorate with small objects. B. Keep floors clear, check furniture stability, and supervise play. C. Let children climb freely. D. Avoid using safety gates. 60. A CDA candidate uses cleaning products near children. What's the mentoring focus? A. Use them when needed. B. Avoid all chemicals. C. Review MSDS guidelines and promote safe storage. D. Let children help clean. CDA Health, Safety, and Nutrition. The CDA Health, Safety, and Nutrition component is a critical area of the Child Development Associate CDA certification that focuses on promoting children's physical well-being in early childhood settings. This section evaluates a candidate's ability to create and maintain a safe, healthy environment by implementing proper hygiene practices, preventing injuries, and managing illnesses. It also covers the planning of nutritious meals and snacks that support healthy growth and development. Key topics include emergency preparedness, safe sleep practices, allergy management, and teaching children healthy habits. This component ensures that CDA candidates can safeguard children's health and safety while fostering wellness through proper nutrition and daily routines. Here are the top 5 beneficial uses of mastering CDA health, safety, and nutrition. 1. Child protection. Educators learn to prevent injuries, respond to emergencies, and maintain a safe, hazard-free environment. 2. Health practices. Mastery includes hygiene routines, illness prevention, and recognizing signs of health concerns in young children. 3. Nutrition support. Providers plan balanced meals and snacks that meet developmental needs and accommodate allergies or restrictions. 4. Regulation compliance. Knowledge ensures adherence to licensing standards and safety protocols in childcare settings. 5. CDA credentialing. This area fulfills a key requirement for earning the CDA, reinforcing professional readiness in early childhood care.